Careful of Google, there's 3 bills, 2 separate bills. It tells you it's about a lot of things put together. What you really need to know is this. There was an original Senate Finance Committee bill that was passed. It was led by Chairman Baucus, and it really took a lot of the information. The Senator Kennedy-led bill was called the Health Bill, Health Pension Committee. But the Senator Finance Bill was the one where you saw the 6 senators sitting together all the time. And Elizabeth Snowe, for example, out of Maine, was really involved in that. Then that's the Patient Protection and Affordable Care Act. These things always have nonsense names. Then you have the Healthcare and Education Reconciliation Act. Follow the news at all? That was what's called budget reconciliation. It was an agreed upon deal by the Senate and the House to put certain pieces of the bill. And so why is this so confusing? This bill contained a whole lot of stuff that this bill then promptly changed. And we have a very confusing system, and most of the national rhetoric on this is wrong because people have trouble following it because nobody reads anything anymore. And this is a criticism of my own profession. The first guy who sends out an alert or a piece on it, everybody else reads it and they copy it and they put it in their own words. And I can't tell you how many times I've seen my own words copied, various other people's words copied, because nobody wants to read 2,000 pages of text anymore. I've got to bill certain hours, I've got to bring in certain revenue. This guy said it, it looks smart, it sounds right, let's go. The second reason a lot of stuff is wrong is most people are doing timeline information. So this will get in the issue of grandfather plans. There's a whole lot of provisions that are effective today, but guess what? As I'll tell you in a minute, they don't apply to you, so you shouldn't care. But if you put them in a timeline, it looks like they apply now. Because I'm not asking it effectively saying, this is only for certain plans that start after this date. So if you really want to Google, and you really don't listen to me, and you really want to read stuff, look for these words, and that will get you to the right spot. Okay, PO is healthcare reform. I mentioned POs were really the pioneer of healthcare reform. They were a long time ago giving access to small businesses that really couldn't find affordable health care on their own. This is long before what we called CHI in Oregon, which is small employer health insurance, and certain mandates. Most everybody that's a small employer, well, everybody that's in Oregon, has certain mandated limits they've got to buy health insurance on, and certain mandated provisions, certain mandated costs. POs have helped get companies around those kind of mandates by having access to a pool and funds and provisions. So this is not a new topic for anybody standing in the back room, and they've made it now 5 minutes. Possible compliance reporting tools. You're going to have help with POs as you've always had all along to help you with all of these difficult things. So do I think POs are going to be different? I do. Do I think they're going to be great for a lot of companies? Yes, because they're going to help you with all the stuff that's hard to handle on your own and why you hired them in the first place. They're going to help you with small business tax credit. They're going to help you with reporting. They're going to help you with how to figure things out. And there's access to expertise and planning. It's really hard for a lot of small companies to pay bills, so you get a lot of resources all pooled together, just like your health insurance plans for PO. So this is nothing new for POs, healthcare reform. And I don't know if that's good or bad, because they didn't help me write that, so maybe they don't like what I'm saying. Understand healthcare reform. The goal is to provide access. So as I told you throughout this whole history lesson, healthcare reform is about access. If you want to understand what healthcare reform will do, ask yourself, will it provide somebody insurance opportunity who doesn't have it under this current system? That answer is always going to be yes. So if you say, do I have to cover this person? The question you should ask is, are they going to be covered somewhere else? And if they are not, there's a good chance your plan will have to cover them, and if not your plan, then the national plan will cover them. Then you've gone right back around and begging the question that if the national plan covers them, you don't have to care. So if the national plan won't, you need to cover them. That's the moral of the story. Access means opportunity to purchase. It does not mean at what price. Okay, if you really have time to kill, you should go to Salem, listen to an insurance hearing, and you'll hear person after person incredibly sobering and tragic stories that should make all of us be happy for the lives we have. Talk about how they cannot get health insurance for their condition. The insurers want to charge them, $1,800 a month or $10,000 a month. Well, if you're going to pay a bill of $1.2 million for somebody, you'd want to charge $1.2 million divided by 12 too. It's not a charity business. What this goal is to make sure somebody has access. Affordability is an entirely separate issue. But that person now gets health insurance. Now we move on to affordability, which this bill is doing, calling cost in lines with means. meaning based on what I can pay is what we're gonna be able to afford, and we're gonna use tax credits and other issues on the insurers that probably only Pacific Source cares about in this audience, of how that's gonna impact insurers. But for your purposes, it's cost along with your needs. Current employer Medicaid or Medicaid-based system won't change. That's how it is. Right now we provide it through employers, through Medicaid, through Medicare's. That does not change. If you don't have an employee plan now, as an employer, if you don't want to cover your employees, you don't have to. After this bill's effective or is effective now, you still don't have to. Nothing changed. So still you can get up and leave. This is all you wanted to hear. What is the difference is individuals are required. They never were required before. There's a lot of constitutional challenges on this point. It's truly the first ever universal mandate the United States of America has ever had. Will those challenges fail or pass? I don't know. I really don't. Rarely does the Supreme Court ever overturn something as comprehensive as this. So it probably will not be successful. But every individual is required to have health insurance. So as an employer, you know everybody sitting in your room is going to have health insurance. Now, as all of you should know, the only time any of you or your employees understand health insurance costs, especially if you're not the business owner here, is when you get a COBRA bill or your employee gets a COBRA bill. And then they immediately march into your office and say, this is absolutely a travesty. How could you overcharge me for health insurance? What money are you trying to make on it? And you say, whoa, this is what your insurance cost all along. You just never knew. That's what the reality is going to be. Is people will start to understand that level of health insurance and what you contribute, and I think this is good news for employers, will hopefully be start to spawn in a positive way. It's no longer an entitlement. No longer you always covered 100%. I'm going to start to understand that when that covered 100%, you paid me essentially 10 grand more a year. And that's the qualitative part of health insurance. It's going to be critical in this bill. Small business health insurance access is limited. There are probably many of you who are sitting as a PEO because it's hard to get health insurance on your own. It's a great benefit of a PEO. That part is going to change a bit, which is why I talked about all the other benefits of organizations that help with the compliance. What is going to be true is all of you that are here, because you're interested in the compliance or operation of healthcare, are going to have a job for an awfully long time. Because it's going to be really confusing on how to report this stuff. Okay, health insurance reform terms. Full-time employee, 30 hours per week. I don't care what you call a full-time employee. For health care reform purposes, a full-time employee is 30 hours. If you define it as 40 hours in your employer handbook, good for you. But for health care reform, it's still 30. Small business, for some of this, is 100 or fewer employees. So if you have 100 or fewer, you're really termed a small business in most of this law. It doesn't mean you get the tax credit. Doesn't mean you're exempt for penalties. Just a small business is 100.